And thank you all for being here today to shed light on a complicated area. I hear a lot of frustration back home over the cost of prescription drugs, and for some people, they actually aren't taking the prescription drugs they should be taking because of those high costs, so it's affecting their health care. And everybody's got a role to play in this along the chain going from the manufacturer to the pharmacy and to the consumer, and one is the PBMs. You've got a role to play in trying to lower costs and bring more transparency, word's been used a lot here today, to the system. People have a right to know. And in Ohio, as Mr. Rice, Mr. Prince probably know, there's currently a lot of discussion about that. I'm sure you've seen the investigative reports from the Columbus Dispatch and other stories regarding disputes between the state and your respective companies. With regard to CVS, there have been concerns that you're withholding savings from the state Medicaid program and not providing equitable reimbursement to pharmacies. In regards to Optum Rx, the state has raised concerns, again, regarding the company withholding savings from Medicaid, and the Attorney General has also accused your company of failing to disclose certain rebates to the Ohio Bureau of Workers' Comp that are contractually supposed to be passed along to the state and to beneficiaries. I'm sure you're aware of those allegations and the stories. First, I'd like to know what your answers are as to why the state and other stakeholders in the system would accuse you of hiding this kind of information. And again, getting back to my comment on transparency, wouldn't transparency solve a lot of this, particularly with regard to the rebates?
Senator, I'll go first. Let me start by first saying that I absolutely share your interest in making sure that we bring the utmost level of transparency to not only the plans, but also the members and the constituencies and consumers in your state as well as other states. The things that we've done, and I think it's been validated through the independent audit report that was conducted as well, that I think we saved the state about $145 million. In the course of that, we've now made a decision as of January 1st of this year that we have no longer spread pricing. And as it relates to your commentary around pharmacy reimbursement, we reimburse the independent pharmacies far higher than the other major chains, including CVS pharmacy retailers as well. So we try to bring a level of transparency such that people can make the right decisions. And even to Senator Thune's earlier comments about consumers needing to be able to healthcare consumers being able to act like consumers, we've also tried to be transparency at the patient level. And the way we've tried to do that is equipping them with the data and the visibility to it such that they can do the comparison shop. So today we have real-time benefits, which enables a physician to, in their office through electronic health records, share with that patient what the out-of-pocket
I totally support that. I think that's critical to getting costs down. Ultimately, yes. Consumers are pretty smart. But I want to give Mr. Prince a chance to respond on the rebates. And let me just say this. If Ohio government, which can bring the full weight of the government down on this issue to find out what the rebates ought to be, is having trouble getting the information, how about the small business out there? I mean, why shouldn't these rebates be more transparent as to the beneficiary, which ultimately is the people I represent in terms of the Medicaid system and the Bureau of Workers' Comp system?
If I could just share, Senator, we pass through 100% of the rebates and discounts.
Yeah, but again,
100%.
Transparency has been the issue that we've not been able to resolve, even in this case with the state of Ohio bringing pressure on the PBM system. Mr. Prince?
Senator, we believe we've delivered against our contract for the state and also for the Bureau. I'm not going to go into the details in the litigation here, but I guess I would say overall we're working closely with them to resolve the matter and making sure we address the concerns for them. From an overall organization, we're very focused on, from a rebate standpoint, point-of-sale discounts. We actually have made, as a organization, we pass on 100% in the Medicare market, 100% in the Medicaid market, and are committed in the commercial market to moving to everybody having point-of-sale discounts. We're not taking on any additional customers in 2020 and beyond unless they do point-of-sale discounts.
Okay.
The matter.
Well, again, that's a matter of transparency also,
right,
so people can see what it is and understand what they're getting. Let me give you one quick story here where PBMs, I think, play a constructive role. And this is with regard to investigation we did in the Permanent Subcommittee investigations on the Evzio product, which is a naloxone product. It's a life-saving thing in the opioid epidemic. This is a miracle drug that reverses the effects of an overdose. Kaleo, a company which provides this Evzio product, had dramatically increased their price. And they did it through kind of a loophole under the Part D Medicare program, saying that doctors should say it's medically necessary. And in that case, the PBM actually was encouraging the lower-priced alternative. And I think that's what your role ought to be. In other words, you all stepped in as a PBM and said, this life-saving care can be provided at a lower cost. Now, when they found the loophole, frankly, the PBMs didn't have any additional role to play. And because the loophole is in our law, we're trying to fix that. And ultimately, I will tell you that the costs went down dramatically once we shone some light on this. But I give that as an example where I think PBMs can play a positive role in the case of trying to keep drug costs down for beneficiaries. Thank you, Mr. Chairman.